Hey, welcome to Medicare 101. I am Randy Bond with Bond Insurance Solutions in Fort Smith, Arkansas. Today, we're on part 4 of our Medicare 101 series, and we're talking about prescription drug coverage. This is one of the areas that can be very costly for seniors. And so we want to give you a brief overview of how prescription drug plans work and how you might be able to save some money on your prescriptions by making sure that you've got the right prescription drug plan. So let's jump into that right now and let's talk about prescription drug plans. So Part D plans are just very simply there to cover your prescription medication. They're only offered through private health insurance companies. Now you can get a standalone Part D plan. This would be for people that have original Medicare and maybe a Medicare supplement, and they just need that part for their drug coverage. They can also be integrated into a Medicare Advantage plan. That's an entirely different route, but that's a nice thing about having that in a Medicare Advantage plan is usually you can get your Part D coverage without any additional premium cost. So let's talk about how Part D plans work. And this is where they can get a little bit complicated. And again, if you need more deep detail, let me encourage you to go to the long video, but we'll give you the snapshots here as we go. Every single plan is going to have what they call a tiered formulary. Now, formulary is just simply a list of the medications that a plan covers. And then the covered drugs are grouped according to the cost, and those groups are called tiers. Now, generally, the lower the tier, the lower your cost. So your generics are usually in tiers 1 and 2. Your name brand drugs are in tiers 3 and 4, and then your specialty medications, those are usually in tier 5. Now, every drug plan is going to work the same way, no matter which one you have. These are Medicare rules. And so every plan is going to have these 4 stages that you could possibly go through. Now, not everyone goes through all the stages. The stages are based on the retail price of the medication that you're taking. Now, that's an important distinction. It's based on the retail price, not on what you're actually paying. And you're going to pay a different amount based on the stage that you're in. So let's talk about how you move from stage to stage and what the cost would be. So the first stage that you might be in, and I say might because not every plan has one, and that would be the deductible phase. A deductible is basically when an insurance plan deducts coverage out for a particular a dollar amount. So if you have car insurance and you have a $500 deductible, basically the insurance company is saying, we're deducting $500 of your incident out of our coverage. So the first $500, that's on you. You pay that and the damages, and then we'll cover the rest. On a drug plan, a deductible is not something that you pay extra to the insurance company, and it's not an extra amount that you pay to the pharmacy. This is where you're paying the full price of your medication until you reach that deductible amount. So the deductible phase feels like you don't have insurance because you're paying for the full price of your medication at that point. And once you've reached the deductible, if there is one, that's when you would move into the initial coverage. So some plans, you might start in the initial coverage and skip the deductible altogether. And you'll be in that phase until your retail prices all add up to $4,020. So you've gotten your medications and all those retail prices have added up. And now once you hit $4,020, that's when you would graduate to the next phase, which is the coverage gap, better known as the donut hole. And you'll stay in that phase until your out-of-pocket cost reaches $6,350. Now, out-of-pocket cost does not include your premium, but that would include what you've already paid during the deductible and the initial coverage, and then anything that you're getting during that phase. Now, the final phase that you might go into would be the catastrophic coverage, and you would be in that for the rest of the year. Then on January 1st, all those stages would reset back to the deductible or initial coverage, whichever your plan would have as the first stage. So how much do you pay? Well, if you're in the deductible phase, you just pay the full price of the medication. When you hit the initial coverage, that's when you're going to pay a set copay, a set dollar amount for your medication, depending on what tier that medication is in. So tier 3, tier 1, you might pay, $3 or $4. Tier 2, you might pay $8 or $10. Tier 3, you might pay $45, something like that. Now, once you move into the out of the initial coverage into the coverage gap or the donut hole, this is where your prices are going to change again. Your cost will change. And this is where you would pay 25% of the retail price of your medication, whether it's a name brand or a generic. And then the final phase is the catastrophic coverage, and you would either pay that set copay of $3.60 for generic, or $8.95 for a brand name drug, or 5%, whichever of those is greater. Now, this is important to know. Your medication cost can fluctuate during the year. It's likely that you could pay a certain amount at the beginning and something very different in the middle and something at the end. So let's use an example. We'll say Bob here has a tier 3 medication, and it has a $400 retail price. So because his plan has a deductible, he's going to pay the full $400 for that medication in January. Now he's met the deductible, and then in February, he's going to be in the initial coverage stage. And during that stage, his particular plan has a $45 copay for a tier 3 medication. Now, whatever plan you sign up for could be different. We're just using this for an illustration. And so for February, March, April, May, and June, anytime he goes to the pharmacy, he pays the pharmacist $45 for that medication. Now, let's say he's taken a number of other medications, and the retail prices of all of those have added up now to $4,020. So that means that come July, he's now moved into the donut hole. And during the donut hole, he's going to pay 25% of that $400 retail price, which is $100. So let's say that he's going to be in the donut hole for 4 months. And so for July, August, September, and October, each time that he goes to the pharmacy, he's now going to pay $100. So his price has gone up a little bit for those 4 months, actually quite a bit. But because he's taken a whole lot of medications and they're expensive, he's now hit that $6,300 total out-of-pocket cost. And in November and December, he's in the coverage gap. Now remember, in the coverage gap, he's taking a name brand drug, so the copay on that is $8.95. And during the coverage gap, you pay either that copay or 5%, whichever is greater. 5% of $400 is $20. 20 is greater than $8.95. So for November and December, he's going to pay $20. Now we just use this as an illustration to help you see your prices can go up and down. And a good agent can help you plan ahead by letting you know how much each of your medications are going to cost and what you'd be paying in total month to month based on the snapshot of the medications that you're taking now. Now, if your doctor changes your medication or gives you a new one, that would certainly have an impact on what your cost would be throughout the year. But what you need to understand is that your costs can go up and down, and a good agent can help you to kind of plan for that so that you can, budget for an owie month like January and maybe some, pain during the summer months when you might be in the donut hole. Now, again, a lot of people that we work with are only in the deductible and initial coverage phase because they're just taking some generic maintenance kind of medications. However, there are some people that are taking things like insulin or some name brand drugs, and so that's kind of driving them into the donut hole, and we can help you see approximately the time frame that you would hit that donut hole if you do, and if you would come out of the donut hole before the end of the year. So a number of people that we work with, they do hit the donut hole, but they're in that for the rest of the year. And we do have a few people that hit all 4 stages. So they're taking quite a few medications, and so their prices are going up and down through the year. So just be aware of that when you have a Part D plan. Now, on that, we know that costs can be very expensive for your medications. There are a lot of expensive medications out there, and particularly if you're hitting the donut hole and things like that, I want you to be aware that Social Security does have a program to help you out if you qualify. Now, anyone who has Medicare could potentially qualify for extra help if you meet the income and asset qualifications. So extra help can assist with your monthly premiums. It can either reduce those or pay for it entirely. It can make your deductible go away, and it can certainly reduce your copays. So all of those can really save you a lot. Social Security estimates that extra help averages about $5,000 in savings per year for people who have this. That's a lot. So what are the income and asset limits? Well, if you're an individual, your income needs to be $19,140 a year or less. And for married couples who are living together, and that's an important distinction there, that combined income needs to be $25,860 or less. So that's one part. So you might qualify based on income, but you might not qualify based on assets. And so that's an important thing because you have to qualify under both guidelines. So the asset limit for an individual is $14,610. For a married couple living together, it's $29,160. Now, things that are not included in your assets would be your home. So the house that you live in, you can own a house fully. And so you can own a house, and the house and the land that your home that you live in is excluded. Your car is excluded. There are a few other things that would be excluded from that. But the things that they're typically looking for would be your checking and savings accounts, your retirement account if you have that, any other kinds of investments that you would have, another piece of property that is not where you're living, but maybe a second piece that you inherited or bought at some point down the road. Those kind of things would count. So we'll leave a link below this video on the website with Social Security that will let you know those kind of things. If you need some help with that, let us know. The application is on that link as well, and you can apply for that. It's a very simple sort of application, but if you do need some help, would be glad to help you out if we can, because this can be a big deal. We know that a lot of seniors struggle between buying their medications and buying their groceries. And if you're in that place, please let us help you out. And if you know somebody who might be in that place, would you be a good friend and share this video with them so that they can be aware that this is out there for them? In our area here, almost 50% of the seniors qualify for extra help. And a lot of them are not aware that they do and are not on that, and they're struggling unnecessarily. So we love helping people get qualified for extra help if they do qualify. Now, again, going back to how Part D plans work, all plans are going to have a pharmacy network. And all the plans have a vast network of pharmacies. But that's important to know, because what we want to look at as an agent is what medications you're taking, but also we want to make sure that the pharmacy is in the network. If the pharmacy is not in the network for a plan that you might be looking at, so you come to me and say, hey, I want to sign up for this Part D plan, and we find out that your pharmacy is not in the network, you would pay the full price for your medication as though you had no insurance. So this is important consideration. And then on pharmacies that are in the network, a plan may have a distinction between preferred pharmacies and standard pharmacies. At a preferred pharmacy, you pay the best price. At a standard pharmacy, you'd pay possibly a higher price. So that's an important thing to be aware of, because we want to try to minimize the amount of change that you're having to do to get the kind of care that you need. And so we want to find the right match of a plan that has the lowest cost on your medication because they cover your medication and they cover it at the lowest tiers and have a good negotiated price with the pharmacy. And then we also want to make sure that your pharmacy is a preferred pharmacy, if possible, in that plan's network. So a few things to be aware of about all prescription drug plans. All of them are going to have things like step therapy. So if your doctor prescribes a brand name drug and there is a generic form of that available, the insurance company is going to want you to try the generic first. And if that doesn't work, they'll cover the brand name drug for you. But they do at least want you to try to save some money and save them some money, quite frankly, and try the generic before you do the name brand drug. Quantity limits could come into play. This is typically on higher risk, higher octane kind of medications. And so we want to try to find a plan that's going to cover the number of pills that you need to take for that particular medication. Some plans may require prior authorization for certain medications, not all of them, but every now and then there may be a prior authorization just to make sure that you're taking the drug for something that they're going to cover it for. And that's, again, for your health and safety that they do that. Now, you can request an exception. So if your doctor prescribes a medication that's not on the plan formulary sometime during the year when you can't change your plan, you can have your doctor request a formulary exception to get that medication covered for the rest of the year for you. Generally within 72 hours, they'll let you know that. They can also do utilization where they increase quantity limits for you, and they might even do tiering exceptions where they reduce a drug tier for you, move a tier 4 down to a tier 3 or something like that, so that you can actually afford to take the medication that you need. So when can you enroll? You can enroll during your initial enrollment period, and if you need more information about when that is, click on that link right there. We did another video on when and how to enroll in Medicare. Basically, your initial enrollment period is the 3 months before you're turning 65, the month that you're turning 65, and the 3 months after. So that's 7-month window. Again, more details on that other video. Now, if you put off enrolling in Medicare Part B and you had group coverage, when you retire is when you can sign up for a Part D plan, and you have a 63-day window from the time that your coverage ends to when you can sign up for a Part D plan without any penalty. And if you miss those, or if you want to change your plan from year to year, Medicare gives you an annual enrollment period from October 15th to December 7th of each year that you can review your plan and change to another plan. Penalty alert, just to know, Part D plans can have a penalty. If you put off signing up for a Part D plan and sign up for it later, then you could face a penalty. So for instance, if you're turning 65 and you're not taking any medication and you're thinking, well, it would be a waste of money for me to get a Part D plan right now, if you waited 2 or 3 years, you could face a penalty. Actually, the time frame does not matter. If you wait any length of time, that penalty is going to be 1% for every month that you did not have a plan from the time that you were first eligible to sign up during your initial enrollment period until the time that you signed up. So if you wait 5 years, that's 5 times 12 months, that's 60%, could be tacked on as a penalty to your premium. So you pay your premium for the plan at that point, plus that 60% penalty. So that could really make a hefty monthly premium, and that penalty will follow you for the rest of your life. So word to the wise is sign up for a Part D plan when you're first eligible for one. If you don't have group benefits or other creditable coverage, then you need to sign up for a Part D plan. If you have questions about that, you can check out that when and how to sign up for Medicare video, or you can certainly contact us and we'll be glad to help you through that decision. So let me give you some quick tips on how to choose the right Part D plan. Number one is to start with the medications that you're currently taking. So not necessarily future medications unless you've been in conversation with your doctor about, well, we may be moving you onto this pretty soon. Like if you're diabetic and you're just taking medication and we're talking about the possibility of having insulin or something, you want to just take the snapshot of what you're taking right now and base the plan based on what you are currently taking. There's no need to get a super deluxe plan, if you will, to pay a high premium for medications that you're not or may not be taking. So let's see if we can match that up to the medications that you're actually taking. And we want to look and see which plan has the lowest annual cost based on the list of medications that you're taking at your preferred pharmacy. So again, we want to try to minimize any kind of change. You have a good relationship with your pharmacist. You know, you've been doing business there. They take good care of you. So we want to try to make sure that your medications are covered right at your pharmacy. So buying by brand name, like I want ABC company, is not always the best approach because they may not have the right coverage. I had one couple that came to me and they said, hey, we've been seeing advertisements for this company and we want to sign up for that. I said, well, let's make sure your medications fit first, if that's okay. And so they said, sure. Well, that was going to be a $10,000 per year mistake for the husband. Based on the medications that he was taking, by simply using a different plan, it would have cost him $10,000 more to go with the company that they were looking at simply because they had seen commercials and liked the brand name. And again, buying by premium doesn't guarantee better protection for your situation. You can find a low premium plan that might be well suited to your current situation. And there's really not much advantage to paying $75 a month when a $20 a month plan will cover you exactly the same. So we want to try to help save you some money on that. And there are ways that we can do that. I really want to stress, take advantage of annual enrollment each year. Your medications, your medication coverage can change. So the plan can change how they're going to cover medication or if they're going to cover medication from year to year. So just because they're covering it this year doesn't mean they're even going to cover it at all next year, or they might cover it at a higher or lower tier, which would affect your cost. And that's one of those things that if you're not reading carefully the annual notice of change that they send you every year, you could get blindsided by a huge increase in your premium or in your drug cost. My dad had been on the same plan for about 10 years. And I knew that he had been given a new medication. And this is the second reason why you want to do a review of your plan during annual enrollment, is because what you're taking could change. And I knew my dad had been given a new medication, and we'd talked about that before. And so I said, hey, let's do a quick review of your plan this year. And he said, no, this company's been taking great care of me for as long as I've been on Medicare. I don't want to change. And I said, well, I know they're a great plan, great company, but let's just look and see. And, sure enough, by simply changing the card that he took, because he moved to a different plan with a different company, and just by taking a new card to the pharmacy, saved $1,000 over the course of the year on that one medication. And so that's a huge deal that you want to be aware of, that your plan could change or your situation could change. And so take advantage of that annual enrollment. Now, a good agent's going to help you do that each year. But I would say if you're not hearing from your agent, reach out to them. If you don't have one, definitely contact us, and we'd be glad to see if we can help you out, see if we can save you some money. If you're in the right plan, we'll tell you. But what we do know is that 80% of Medicare beneficiaries are in the wrong prescription drug plan. What that means is that if they were in a different plan for that year than what they're currently on, they would have saved money. And so we want to help save you money on your prescriptions. So if you do want to explore or enroll in Part D plans, you can call us. The phone number is right there on the screen, or you can email us, and we can certainly do in-person appointments. Now, we are very careful during this COVID time about how we do that. And if you live far away, we can do that by Zoom or some other platform like that. So we can do things by phone, we can do it online. And I don't even mind using that old school mail if we need to. So we're here to help, want to help you save money on your prescriptions. And if you'd like to see if we can help you do that, would be glad to do that. I'm an independent Medicare agent. You can see my license number down at the bottom of the screen over there. And as an independent Medicare agent, I am not affiliated with Medicare, the Centers for Medicare Services, or the federal government or any government agency. I am not a captive agent with any company. As an independent, I represent all the plans in our area. And so we try to be impartial and help you to find the right plan for your situation to save you the most money and get the most out of your Medicare. So if we can help you out, I'd be glad to do that. If you found this video to be helpful, we hope that you'll like and subscribe. We're going to do more videos on how to make the most out of Medicare, just some Medicare 101 basics in there as well. And if you think this will help somebody else, I hope that you'll share it with them as well. Thank you so much. We'll look forward to seeing you in our next videos.